Welcome to POSH Solutions. Element 2. How Health and Safety Management System work, and what they look like. Learning Objectives. 2.1. Give an overview of the elements of health and safety management systems, and the benefits of having a formal, certified system. 2.2. Discuss the main ingredients of health and safety management systems that make it effective. Policy, responsibilities, arrangements. 2.1. Occupational Health and Safety Management System. Introduction. Every organization must have a clear policy for health and safety. Everyone in the organization must be aware of the organization's health and safety aims and objectives. A good health and safety policy will improve the organization's performance by reducing accidents and financial losses. Plan, do, check, act is a four-step process used to improve the quality of the organization. The safety management systems have a common principle which is stated in ILO OSH 2001, ISO 45001, HSE 65, ILO OSH 2001, OSH Management System. Policy. Policy is a clear statement to achieve health and safety standards. It is also a top management commitment. Organizing. Important element of health and safety management system. Roles and responsibilities must be clearly defined for everyone in the organization. There must be visible leadership from senior management to support health and safety management system to set as an example for lower-level employees to work safely. Planning and implementation. Planning is an important element of health and safety management system. The employer must have plans in place to identify the hazards and introduce suitable control measures by changing the process or improving the design, providing suitable work equipment. Safe system of work, or providing personal protective equipment, can be introduced to reduce risk level. Evaluation means measuring the performance of the organization to check whether the organization is moving in the right direction to achieve the objectives. To measure the performance, we use two indicators. 1. Active or proactive monitoring. 2. Reactive monitoring. We will discuss about these indicators in details later. Audit. Auditing is an independent, critical examination of health and safety management systems to check all the systems are working effectively. Actions for improvement. Any weakness identified during the review process, here we take corrective actions to rectify the errors. Make necessary arrangements in all the elements of health and safety management systems. Continual improvement. Enhancing occupational health and safety management system, improving overall performance, in line with OH&S policy. ISO 45001-2018, sets the framework for establishing, implementing, and maintaining an occupational health and safety OH&S management system, managing OH&S risks and opportunities. Its aim is to promote and protect the physical and mental health of workers, a responsibility held by any organization. It is non-prescriptive in nature, being applicable to any organization, regardless of size. Element 2, page, go through the standard for detailed information. Benefits of achieving certification. If your organization is following OH&S standards, it will help them to manage their OH&S risks and improve their OH&S performance by developing and implementing effective policies and objectives. The other benefits includes reduction of workplace incidents, reduced absenteeism and staff turnover, hence increasing the productivity, reduced insurance premiums costs, creating a positive health and safety culture. Employees are encouraged to actively show their commitment towards OH&S. Top management is committed to improve OH&S performance. The organization will be able to fulfill the legal and regulatory requirements. Enhanced business reputation. Improved staff morale. Integrating ISO 45001 management systems helps to win business contracts externally. The organization may use any model, either ILO OSH 2001 or ISO 45001. It is necessary to spin around the cycle more than once, especially initial business setup, developing new process, service, or product, followed by any changes in the organization. 2.2. Making the management system work. The Health and Safety Policy. Introduction to Health and Safety Policy. Health and Safety Policy gives direction to an organization by setting priorities. Everyone in the organization must be aware of health and safety, aims and objectives, the arrangements in place, and the standards that are established to protect business, employees, and others. The policy should influence the decision made by the organization. Decision from the top management should influence on allocation of resources, setting standards for health and safety. The middle management must ensure that the decisions made meets the aims of the policy and does not deviate from the set aims and objectives. Health and safety policy must be specific to each organization, because every organization has different working methods and hazards involved. No one size fits all. For example, the risk involved in a construction company may vary from the risk involved in a supermarket. The aims and objectives are different for each organization. The policy authorize the top management commitment and its approach towards health and safety. 3 sections of a health and safety policy. Statement of intent. Statement of intent, or incorrectly called as health and safety policy, will have aims which are not measurable and objectives which are measurable of the organization. Aims remains unchanged during the review process, whereas the objectives are changed during the review of the health and safety policy. The policy must be written down in a simple language so that it will be easy for everyone to understand. To make it clear, it can be written down into bullet points. The statement of intent must be signed and dated by the senior-most person in the organization, for example, CEO or managing director, because it shows leadership commitment. It also gives authority to the policy. Overall health and safety responsibilities lies with the top management. The date indicates the frequency to review the policy. The policy must be developed and communicated at all levels in the organization. The policy must be prepared by the organization, and not someone external to the organization, as the policy has to address key issues within the organization. Health and safety, performance targets, a significant part of statement of intent. Organization must set SMART targets, which means the targets must be specific, measurable, achievable, realistic, time-bound. Managers are responsible to ensure that objectives are met, and they must monitor the progress. It must be recorded and reported. Objectives must be annually reviewed for continual improvement. Let's see some examples of the SMART targets an organization can set in statement of intent. Reducing sickness absence rates. Reduction in number of accidents, incidents, ill health. Reduction in enforcement actions. Completing the training related to health and safety to all the supervisors and managers in next 6 months. Completion of workplace inspections. Completion of workplace risk assessments covering all the activities in next 8 months. Improve the system for recording near misses and accidents. Conducting regular health surveillance to the workers once in every 3 months. Improving the safety culture within the organization by involving workers through consultation in decision-making process. Benchmarking. Comparing your organization with similar organization to identify the weakness in our system. To compare what best practices are adopted by the other organization to reduce accidents as well as to improve performance. Benchmarking helps to identify the key performance indicators so that the best practices can be developed and implemented in our organization. Organization section. Organization section. Clearly defining the roles and responsibilities of each individuals in the organization, so that everyone in the organization are aware of their roles to achieve the organizational aims. This can be demonstrated through a hierarchy and the reporting line of structure. There are also specific responsibilities that are clearly allocated, for example, first aider, firefighter, HSE advisor. Defining clear roles will also improve a positive safety culture. We already discussed the roles of various parties in Element 1, 1.3, Arrangements section. This section deals with specific systems and procedures that will help to implement the policy. This section will give a detailed information on how health and safety aims will be achieved through the implementation, maintenance, monitoring, and review of preventative and protective measures. General arrangements. Planning includes policy development, setting targets, arrangements for communicating the policy, allocating budget, hazard identification, carrying out risk assessment, developing procedures for reporting near misses, accidents, procedures for carrying out investigations and taking corrective actions, developing safe system of work and permit to control hazards in high-risk activities, worker consultation and communication, provision of training, welfare facilities and housekeeping arrangements, monitoring and inspection arrangements for tools, equipment, machinery, workplace and other similar things, emergency procedures, for example, medical emergency, monitoring, carrying out third-party audits, provision of personal protective equipment, conducting health surveillance and maintaining records, measuring performance, active and reactive monitoring methods, specific arrangements such as to deal with drug and alcohol site rules and control measures, bullying and violence at work, prohibition policy, reporting systems, monitoring lone working and emergency procedures for lone working, stress, noise, vibration, and radiation at work, setting exposure limits, manual handling arrangements and control by using mechanical devices, selection of contractors, control of visitors through vetting them, fire arrangements, including procedures for responding to an alarm, reviewing health and safety policy. The health and safety policy must be reviewed at regular intervals. There are situations that might insist you to review health and safety policy are as follows. Follow changes in the workplace, environment, workforce, for example, new director or CEO has taken charge, in the legal documents or standards, work process or activity. When you introduce a new technology, followed by audit findings and suggestion from the auditor to review policy, following worker consultation. And significantly, every year, the policy must be reviewed. Reasons for policy to become ineffective. Lack of top management commitment, directors and senior managers who fail to drive the policy. No annual objectives set. Health and safety is not given priority. Resources not allocated. Aims and intentions are not clearly understood by all employees. The policy emphasis much on employee responsibilities and is not management-led. Not measuring performance. Management is unaware of the role in health and safety. Receives no training to enable them to implement actions required. End of Element 2.